Thank you for your interest in this poster on a curriculum for internal medicine residents about the management of patients with alcohol use disorder. Unfortunately, alcohol use disorder is common, but also commonly undertreated. The goal of our curriculum was to improve residents' confidence, knowledge, and attitudes about mutual support groups, addiction treatment services, and pharmacotherapy for patients with alcohol use disorder. Our curriculum was delivered to all categorical internal medicine residents in our program, and it was delivered in a series of 3 30-minute educational sessions prior to continuity clinics. In the first session, residents were introduced to the topic using a case-based discussion, and then they viewed a novel educational video using speed and animation techniques. In the second session, the residents were asked to discuss and apply what they had learned from the first educational video, and then they watched another speed animation video on pharmacotherapy for alcohol use disorder. In the final session, residents applied the lessons from the pharmacotherapy video to a series of case vignettes, and then had time to reflect on their own practices. We evaluated our curriculum using pre and post tests that looked at knowledge, confidence, and attitudes. We assessed knowledge using a 30-item true-false test that we developed with the help of local content experts. We assessed confidence looking both at global confidence as well as confidence specifically related to mutual support groups, addiction treatment services, and pharmacotherapy. We used a pre-validated 11-item Likert scale called the Survey of Attitudes and Perceptions to assess attitudes after modifying it to reflect person-first language. All of our faculty facilitators were surveyed about their experiences teaching this curriculum. Moving on to our results, 153 residents were able to participate in the curriculum, and of those residents, 97 completed the pre-test and 53 completed the post-test. Our final analysis included only the 35 residents who completed both pre- and post-testing so that we could look at paired data for our statistical analysis. As you can see in Table 1, we had a nice mix of residents from all 3 years of training and from all 3 of our major clinical sites. Moving on to our results, we found that residents showed a statistically significant improvement in knowledge, attitudes, and confidence after completing our curriculum. Interestingly, the greatest gains in confidence were related to confidence around pharmacotherapy for alcohol use disorder. The improvements in our knowledge test results were also largely driven by changes in the pharmacotherapy scores. 81% of the faculty who taught our curriculum completed our survey about their experiences facilitating. And interestingly, all of our faculty agreed or strongly agreed that they would be happy to teach the curriculum again, and that teaching this curriculum increased their own confidence in helping medical learners care for patients with alcohol use disorder who may be candidates for pharmacotherapy. In conclusion, our brief 3-part curriculum improved knowledge, confidence, and attitudes on the management of alcohol use disorder, with the greatest improvements related to pharmacotherapy. Importantly, faculty facilitators were satisfied with this curriculum, which we hope means that it may be a candidate for dissemination to other programs. Thank you again for your attention.